Oftentimes in today's fast-paced world, there isn't a lot of time for nurses to really get to know a patient or their families. And so we find that RNs that come to us absolutely love this aspect of it. They get to know the families, they get to know the patients, and because of that, they learn more about the patient's needs from a medical standpoint and a social standpoint.
At Haven, we want everybody to feel like they're part of a team and that we're all moving in the same direction towards the same common goal.
I think John and Bethany's background has been very key in the success of this business for the fact that you have actual clinician-minded people, they're therapists, so they're not business people trying to run a clinical company.
I know for us, I know what the industry standard is, for example, for a nurse to show up once every 14 days. Well, here we have nurses that show up once a week, twice a week sometimes even 3 times a week to take care of the patients. So we're trying to be way over and above what the industry standard is.
I've seen people that didn't think they could walk, or people who could not move because of broken limbs, and teaching them how to take care of themselves and execute some things to get them back to moving around their house safely and doing what they want to do again.
When I hire someone, I want to know that they really care about the patients, that they want to be there, that they're willing to have the courage to enter into some of the really hard conversations that need to happen at this time of life.
You don't have to be the best, but you have to be willing to learn and grow with the company.
Our goal is to keep the patients home out of the hospital, so the only way we're going to do that is if everyone's communicating so that we can provide the best care for that patient.
People are themselves a lot more in their homes. The uniqueness of people really show up in their homes. And what better place to provide a meaningful interaction than in somebody's home where they're the most comfortable.
It's a lot more challenging, but it's also a lot more rewarding. Those patients are in the homes, some of them are scared, some of them don't really understand what's going on with their bodies, and that RN is really their only link to the healthcare that they need. You're really affecting the quality of life of these individuals, and that's what seems to be very rewarding for many of our nurses.